This is your host, Laura Winters, the heart-led pathfinder, intuitive energy healer, speech-language pathologist, and owner of Your Light Holistic Therapy and Wellness, LLC. Welcome to Miracle in Time, a mini-series podcast that brings you the stories of beautiful humans exploring the synchronicities, blessings, and miracles within our perception of time. It illustrates that events are not just happening to us, but for us. Life isn't always rainbows and butterflies, but it is a miracle in time. As a disclaimer, this podcast contains general information about various topics and medical conditions and is for educational purposes and inspiration only. Your Light Holistic Therapy and Wellness LLC is not responsible or liable for the accuracy of information contained in this podcast. The information contained in this episode is the personal views of the host and guests respectively. This podcast is not meant to replace the advice of your healthcare provider and is not intended to prescribe, prevent, treat, or diagnose disease. You assume all risks when you continue this episode. Dr. Ada Noh, OD, is the founder of Noh Eyes, where she specializes in the diagnosis and management of dry eye disease. Passionate about advancing patient care and practitioner education, she frequently lectures on dry eye therapies and emerging treatment strategies. Dr. Noh earned her undergraduate degree from the University of Pittsburgh and her Doctor of Optometry degree from the Pennsylvania College of Optometry. Through both her clinical practice and speaking engagements, she is dedicated to improving quality of life for patients and raising awareness of ocular surface disease among eye care professionals. I hope you enjoy this miracle in time.
Hi. How are you?
Good. How are you doing?
I'm good. I'm happy to see you.
Oh, it's so nice to see you too.
It's been a long time.
A long time. Years.
How long? Has it?
I don't know. I feel like it's been a couple years.
It probably
I feel like
has. I'm not sure. But that's okay. I'm happy to see you either way.
You know, there have been so many times where I'm going to go down there and see her.
Oh.
And then my father-in-law found I don't know if it's like a gem place or like a diamond mining place close by. And I was like, oh, we'll go down there and then we'll see her and then we'll just spend days there trying to find diamonds. And then.
Perfect. Yeah. And so I just looked back at my email. It was May of 2023.
Oh,
so it's been like 2 years.
Yeah.
It's crazy.
I know. And I have to say, I love seeing your reels. I love seeing you on Instagram. I mean, even back then, I was like, dang, you really are doing some cool things. And you just keep doing more and more. And you're just being so real. I mean, it's truly just you on a plate. There's no fakeness, no nothing. It's literally just you.
So thank you so much. That's really nice of you to say. It's very interesting because I'm authentically who I am, in real life, in whatever. And that's really important to me, right? Yeah. But it's interesting that you say that you're real because sometimes people are like, oh, you're so positive and your life seems so great. And I was like, wait, hold on. The whole point is that I'm trying to show that is not what my life is, right? You can have a positive outlook on life, but there are some crappy things, not lovely things that have happened and that I've had to navigate. So I'm maybe I need to be talking about the bad things or the bad days more, even though I feel I do talk about it.
Yeah. Well, I think that what you're doing, like the traveling for me is like, oh my God, that would be so amazing. And I know that that's not amazing though. Like you waiting at an airport and like, you know, you having to get Ubers or whatever. And then you're trying to figure out what you're going to eat. And like, you know, we can go like, oh, I would just love to do that forever. And that you do it so much that I think it's like, you know?
It's so relative because like so much to me, like it just depends. And like, obviously my clinic and my life has changed significantly in the past 2 years, but like, it's crazy because like part of it is hard work and like being true to who I am and showing up like for myself, for my patients and stuff every day. But also part of it is like life circumstance that was not in my control or was not planned. Right. And like, I think that's one of the beautiful things about like my current story is that like, it's not what I thought it was going to be, right? The plan was, hey, we're going to raise a family here in Arkansas. That was the plan, right? But I don't know how much you know, but my husband's job moved him.
Okay.
Pretty much. So he got a new job.
In Texas.
Yeah, in Dallas area.
Yeah.
So we actually like, he was going back and forth every single week for a year. Because we were still like I was in Little Rock and we had an apartment in Dallas and he would come back and forth. And it was too much, right? Like that's every single week. So I was like, well, this is crazy. But like, if I go back and forth, I can make it my own schedule because I decide, and I made mine every other week. So I did that for a while.
Yeah.
And then just like higher power, things happened. And then like Dr. Brogdon, like everything just like worked out. So now she's there and doing awesome. So now I just go back to clinic once a month, but it's like people assume this like crazy success story. And I'm like, hold on, no, wait a minute. That's not, nope. It's not necessarily that I was growing that much or could afford that, right? Like, it's just like life happens and you have to learn to pivot with it. So like, if you ask business people, does this make number sense? No, that's not the case, right? And like, that's what I really try to tell people when they're like, you're doing amazing. You added another doctor. And I'm like, but that's not what normal people like. That's not why, right? Like, that's so important. Also, for like people to not feel guilty about like, hey, sometimes it doesn't make money sense, or like, that's not the only reason why people do things, right? It's life.
Yes, totally. Oh, but I love it. I mean, like even the first time we talked, you were looking at hiring like a front staff person, and you were like, oh my gosh, I just hope I find the right person. And I'm like, girl, just put it out there that you're going to align with the right person. And I saw her on a reel just like a week ago. I'm like, the same girl. I'm like, dang, you made it work. Like the universe is like, girl, this is your person. Like totally.
Yeah. So that's so funny because, you know, when I opened, I did everything by myself. And then a year in, I hired Haley, and Haley is still there and like such a crucial part of the office. And like all the patients know her, and like her presence there when I'm not there really gives patients stability, right? Because like one day a patient called, she had an accident, so I hadn't seen her in a while, and it was somebody else that was answering the phone. It wasn't Haley. And then they were like, oh, do you want to see Dr. Brogdon? And she was like, hold on, number one, who are you? Who is this doctor? Like, where's Dr. No and where's Haley? Like, so it's nice when she's there because she helps. You know, she's like, nope, everything's still good. Like, we're still here. It's just like life circumstance, right?
Yes.
And like, I'm very honest with my patients. Like, they know, like, because I don't want them to panic when they call to be like, what do you mean there's another person? Like, is she still coming? Right? Like, that's so much of that mental and emotional aspect of dry eye, right? That's really important. That like, we're not leaving you. It's okay. We just like, the clinic has to work for me or else it doesn't exist, right?
Correct.
So it's just like figuring that all out.
Yeah. Oh my gosh. I can just imagine. Okay. So first, I want you to introduce yourself to everybody because I will have already done an introduction, but it does not do you justice. So tell everybody about you.
There's nothing to tell about me. My name's Ada Noh, and I have a clinic that's a dry eye only clinic in Little Rock, Arkansas, but I live in the suburbs of Dallas. So I see patients part-time. And then I do some consulting work, you know, traveling. And so I think the brightest thing, or the thing that I would want people to know about me, is that you can make your own life in whatever circumstance. It's not like conventional, or like other people aren't doing this, and it's not because I'm anything special. It's just because you tried something or worked hard at something, and not everything worked out for me. You know, there's definitely tons of no's that I've gotten, or things that I wanted that I didn't get, but life works out for a reason, right? Whatever that may be.
Yeah. Yeah, for sure. So where did your journey into dry eye begin?
Where? In terms of as a practitioner or as a patient?
Everything. Like, where did this all start?
Okay, so I started having dry eye symptoms probably in my late 20s, early 30s. And I usually wear correction, but I'm nearsighted, so like I can see you without my glasses. They're right here. Okay, because I don't wear contacts almost never, right? So I just remember some days I would wake up in the morning and my eyes would feel like on fire. And I'm like, this is terrible. Like, how am I supposed to function? And like, it would make me grumpy because I didn't feel good, right? Or I didn't feel rested. And now there's so much coming out now in like the new studies about how sleep and dry eye are like really linked also. So I didn't know this, 10 years ago. So it kind of made me just like think about like, hey, I'm young and I'm having these symptoms. So I don't have any autoimmune disease or, any risk factors. So I can't imagine how people who are, older than me or going through menopause or specific things that really trigger it are feeling, or how they're dealing with it. So at that time I was living in New Jersey and working at a private practice. So we were like starting to do some dry eye stuff. I graduated with tons of student loan debt. And so I worked a lot. And so I got really burned out. And I was like really thinking about leaving optometry. I think I told you that, because I was like, I hate this profession. Like, I don't like anything about it. I'm sick of seeing patients, blah, blah, blah. So at that time, we also relocated to Arkansas. And that's when I was like, well, I'm going to just do this and we'll just see how it goes. Because it was like the only piece of optometry that I feel like I enjoyed or didn't mind.
Yeah. And it's kind of wild that like it was something for you that initiated kind of that spark, right? Like you would have known about dry eye, but like you wouldn't have had your own personal experience to be able to bring to the table. And so, yeah, it's just pretty amazing how that kind of probably brought you into the niche that you're in.
Yes. And like people are like, what do you mean you just did that? I'm like, I didn't wait and sit. Nobody gave me permission that I could make this new kind of practice, or like that I was smart enough to do that. Now that I'm like very, in the dry eye community, like as a practitioner on a national level, like people will say that to me. They're like, well, where did you learn it? I was like, I don't know. I just figured it out. Like, no, I didn't have a teacher. I didn't do residency in Corny. Like, I just figured it out. Right. And so I like to use the word scrappy, where it's like, whatever your resources are, as much as you have or as little as you have, like you make it work, right? But that's like resilience, and that's like in life, right? Like you need that. Whatever you're doing, not dry eye related, not business owner, doesn't matter, right?
Exactly. Yeah, you totally need it.
Yes. And it served me well in many aspects of my life, right?
So for people who don't really know about dry eye, like what are some symptoms? What are some things that are happening behind the scenes? What are some things that they can be looking out for?
Good question. So the number one symptom of dry eye disease is actually fluctuating vision. It's not any like feeling or sensation. It's like if your tears aren't of good quality or not thick enough, what's going to happen is it starts to affect what you see, because light first hits your tear film, right? So when a patient, if they have to like blink and it changes their vision, right? And there's like adjustments through the day, that is the number one symptom of dry eye disease, right? Now, that happens to a lot of people. And then eventually, because this is like a chronic cycle and kind of a landslide kind of thing, people will have like dry, sandy, burning, gritty, something feels like it's in their eye, but also like recurrent styes. Like I have this whole subset of patients now coming in because they have these recurrent styes because their meibomian glands aren't secreting good oil and they're getting clogged up, which is giving them styes. That's all dry eye related, right? So it's so many things that's not just like, oh, your eye feels dry, right? Because sometimes patients are like, do I have dry eye? And when I talk to them, I'm like, I think you do. Right. Yeah. So I think I posted the other day because I was talking to somebody and like they were saying all of these symptoms and they were not realizing that they're dry eye symptoms. And I'm like, unbiased, right? Because I'm like, that's so obviously dry eye. Like, what do you mean? But I'm like, how can we like bridge this gap? Because so many people, by the time they get to me, are so frustrated, and they've been to 100 billion doctors and everyone's written them off or haven't helped them. And I'm like, how can we get this message out to like the greater public about like what these things can be? Because it's so prevalent.
It's so prevalent. There's so many people. And that was kind of the reason me bringing this back up, was because more and more people kept saying things about dry eye, or like, my eyes are bothering me or whatever. And I used to go, well, I have this podcast that you can go listen to and find out all this information. And I don't anymore. So I'm like, I need to like rebirth this for everyone, because it is so prevalent. So many people are having issues, and that information needs to get out there.
Yes, for sure. It's like, dry eye is so common, but it's so over, like, just because it's common doesn't mean that it's normal. But I think a lot of times it's normalized, or people address it when it becomes like a severe issue. But just like anything in healthcare, it's a lot easier to manage and treat that condition if we get it at an earlier stage, right? By the time it's the end, it's like you're wanting me to light a house on fire, but you're giving me one kindling. Like, I can't do that, right? So
yeah,
that's like the next kind of step of like, okay, the practices, you know, we have patients, and like, it's great because Little Rock is a small town, so word kind of travels well. So like, I feel like people have dry eye, they are coming here. But my next kind of thing is like, why am I getting patients when it is a disaster? Like, can we try to, it's better for the referring doctor because the patient's not going to be mad at you. It's better for the patient. It's better for me because their outcomes are going to be a lot better, right? So like, that's my next thing of like, why are you waiting, right? And I think for me, that's like telling people like, these glands die. Like, do not send them to me when they are dead, right? And I think sometimes that can wake people up to be like, oh my gosh, stuff dies, like irreversible damage. Like, we got to get it before that's a problem.
Yeah. And I'm finding that even in my practice itself, you know, people are like, well, are you just seeing speech therapy patients? And I like, yeah, they have a component, but also part of my job is prevention. Like, if there's something that I can do now to prevent cognitive decline or swallowing problems in the future, well, then, yeah, I'm going to do it because I see something that's not exactly right. So if we start seeing these little signs, you know, that prevention piece is super important so that you aren't having to put out these dumpster fires.
Right. Or it makes my life a lot easier versus like, you know, I have patients that are crying in my chair being like, I told my eye doctor, I've told them about this for years and no one's told me anything. Right. And then that puts me in a weird situation because I'm like, yeah, they should have sent you sooner, but I'm meeting them that day. You know, what can I do?
Exactly. So if someone does notice that they're having these symptoms of dry eye, they tell their doctor, they may or may not do something. What do you think is like the best next step to actually like take hold of what is going on?
I want to also say one other thing about like how common it is. A lot of times people talk about like contact lens wear. Like, if people cannot comfortably wear contacts, like for, you know, 8 to 10 to 12 hours, that's not normal. It's not normal that when you take them out, you're like, oh, right? It's common, but it's not normal. Okay. And that's because what the contact lens is actually sitting on is your tears or your tear film. So if there's not enough or it's not healthy enough, you're going to start to have the contact rubbing on the eye, which is why it becomes uncomfortable, right? And then the vision's not good, blah, blah, blah. The other thing is like the risk factors that are so common is like screen time, right? Hormones, women, but, it's just so prevalent. So many different autoimmune diseases. Like, it is insane. I'm working on this lecture about systemic etiologies of dry eye disease. And like, I'm learning as I'm writing this lecture, and I'm like, oh my gosh, it's everywhere, right? But okay, going back to what to do, right? I think that we are in a better place now than we were 2 years ago, because I do think that there's more practitioners doing better work. But when you still look at like the nation as a whole, there's still a lot more improvement that we can do, right? So one of the best tests, like if you're just trying to screen for who to go to, because it's really frustrating. You call, you wait months or weeks for an appointment, you get there, you get 5 minutes, and then it's like, they told you to use drops, right? It's not, you just feel downtrodden or wasted. And it's like, well, what do you do? See another doctor to hope that that one's going to be different, right? So what I would call it, I would ask when you call a doctor's office is like, what kind of dry eye testing do you do? Right? To see if like, does the staff know? Because if they're a well-run and well-established clinic, most likely they're going to at least know some of the tests. If they have no answers for you, then they're maybe not doing so much, right? I think we've discussed before, but mybography is my favorite test. So even if you say, hey, do you guys do mybography, right? It's checking for the glands that are most affected in dry eye disease. Like 85% of the time, it's the meibomian gland. So most of the time, that's going to screen that issue. If they don't have it, it's like you don't have the X-ray or the CAT scan. Like you're really guessing in terms of like where that disease state is at or how urgent things are. So that's like an early, quick, easy way. If they do mybography, probably you've got a better chance that that they know what they're doing or that they have some other options for you.
Yeah. That's really good to know. And then, so what does, I've always wanted to do this, and I still want to do this maybe in the future, but is to actually have like a recorded episode of a full-on dry eye evaluation, like a really cool start to finish deal of like the ideal evaluation so that people really know what they're getting and what they should be looking for. Cause we just don't really know. We just go in and just hope that they're doing the right stuff. Right. But what does that look like for you?
Good question. And I would say the caveat is that like every practitioner is going to have a little bit different flavor and not do all of the exact same tests. So I don't think there's 100% like these have to be done, because I don't do some tests that other people do and I treat my patients just fine.
Yeah.
And other practitioners may feel that way about me, right? I have some things that nobody else really has, but they're doing fine for their patient. So the first thing that I do ahead of appointments is I send out this questionnaire that's super detailed and probably really annoying for patients, but it tells us about not just their current state, but about their lifestyle things. Like how often are you in populated areas or on computer or drinking caffeine or tons of other things. And then also like, what have you already tried, right? Because I look at all of those questionnaire answers before I go in with the patient so that they don't have to tell me, right? It's hard for them to come up to, they a lot of times think that they're only going to get 5 minutes with me. So it's like word vomit and they're like, blah, 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 and this and this and this. And I'm like, okay, let's work through all of this stuff because we got to figure it out, right? Because I don't want to waste their time doing things if we already know it's not going to work, right? So I want it in like disgusting detail. Like they gave me drops and they didn't work. Okay, well, which drops? Well, how long were you on them? Well, how did you dose them? What was your compliance? Right? So many things of why it didn't work. So I probably spend like at least 15 minutes on just like medical history. And I don't like my technicians work any of that up because like I get so much knowledge from that, right? Clues in terms of how I can help them. And I'm also like evaluating the patient's face as I'm talking to them to see like, do your lids look really lax? Do I think your blink is not complete? Like so many things while I'm talking to them. And then I'll go into like mybography, non-invasive tear breakup time, do stain, corneal nerve sensitivity. Like there's a slew of different tests that we do. Some that I do only when necessary, some that I do every time, right? It kind of depends on the patient. But I kind of have like a hierarchy in my head in terms of what I treat first or like my methodology, I guess, which is, again, that's mine. Not everyone does it the same way.
Yeah. And that's what I love. I love talking to you because you do put so much, I guess, like, just care to the patient themselves. Like they're the ones who know themselves best and you understand that and you know what they've been through and that you know that there's this huge emotional component to it. And so if you're not giving them the time of day to be able to tell their story, you're actually missing a huge piece of that. And like you said, the amount of information that you glean from it. I know, like when people come into my office, my first visit is 2 hours long and they go, really? And I go, but that first hour, literally, they're throwing up all the stuff all over the table. And then I'm picking up the pieces to decide where we go next. But that is part of the healing process. Is that saying everything that you need to say because no one has listened thus far.
Yes, which is like the most heartbreaking part to me, to be like, why did you have to come all the way here? I'm happy to do it. But literally I'm like, and anything else? like anything else, right? Because it's like they've never, and that's what I tell them, like when patients start word vomiting, because maybe they don't realize how much time that we will have together, I'm like, we're going to take our time and we're going to talk about all of those things. So like, let's go back to this, and I want this in detail, right? And then then you start to see like the walls come down a little bit, like, okay, like she's going to listen to this, right? But I feel like sometimes they're just like, burp, 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 burp. Here's the highlights, these are the biggest problems, like help me, please help me, right? So
yeah.
I never like to give false hope to patients because I think that that's wrong, right? But I think listening and then being like, hey, but there's still things that we've actually never addressed or never been talked about. I do think that I can help you. I always make it very clear I cannot cure you because there's no cure, right? And helping you just means an improvement, not like abolishment of any of your symptoms. That's so important, right? But I do think that we can get you to a better place, right? So it's like, oftentimes the line that patients usually say to me is like, I feel like I have hope for the first time in so long. And like, I'm happy to give you hope, but I just don't want to oversell you on that. Like, I'm also hopeful, but let's also be realistic, right? Like,
yeah,
that's a delicate balance because I don't want to oversell or tell them things that I know that I cannot do.
Right.
Right. So,
right.
But it is crazy. And then like, that's where like the referrals from by word of mouth just like come in, because these patients like, oh, like you have to go here. She helped me and she listened and she knows what she's doing. Right. So, and then those patients go back to their rheumatologist or their ophthalmologist or whatever. And they're like, oh my gosh, these things I struggled with, like she was able to help me. So as the clinic is open longer, now we have different avenues or resources of referrals that we didn't have obviously when we opened.
Oh, that's really, really cool. And then now that you're in Texas part-time or most of the time, where are you at now there?
Good question. So I work at a clinic in the DFW area 1 day a week for the weeks that I'm here. Does that make sense? Yeah. So there's 3 doctors at that office. So if someone's out, like I'll pick up a day. So usually, it's like 3 to 4 to 5 days a month there. And then I'll be at my Little Rock clinic about 4 days a month. And then it is mind blowing to me because I was like, oh my gosh, I'm going to have all this free time. No. I mean, today I already had 2 calls before I'm talking to you. I have a meeting tonight. I'm working on lectures. I'm traveling for lectures. So it's like, it is crazy how your schedule fills. And I don't know if like I opened it up and that's why I'm being blessed with it. But it was kind of by accident almost. I don't know.
I love that. And that's that's you coming across so authentic. That's bringing you to these next levels. Like you being able to do all these talks and people wanting you to be there because you are literally just being you and just embodying just like this. I know you're like, think I'm just talking you up, but I mean, you're like, what is she talking about? But it's true. Like you are the physical embodiment of like doing your, like being here and living out your purpose.
It is just crazy to me because when people are like, how did you do it? Like, what makes you unique? I'm like, literally nothing. Like, I have no idea how I did. Like, I mean, I did work. I did a lot of work, but like, what makes me special? Like, there's not really, I don't have an answer, and that's not being humble. Like, I'm not the smartest person in the room. Like, maybe my superpower is that I am just genuinely who I am, but like, that's not anything that special. But being comfortable to be that, I guess.
Exactly. What I think that is special. I mean, that is your superpower. There are so many people that are just walking around, just living the life that they think everybody else wanted them to live. And you're not doing that. Like you are creating your own life the way that you want it. And I think for people to see that, it's like, oh my gosh, it's actually possible. Like I don't have to do all these things that I don't want to do. Like things will align and things will work out when I am just being who I'm meant to be.
Yes, I will say that luck has been on my side for sure in certain times, and also like life is beautiful because it's all pivots, right? Like I'm in this situation by chance, not because I planned or intended it to be there. And I don't know if this is going to be my long term, right? Like for now, this is great. I'm happy. But I think the things is like, nobody has to give you permission, right? Nobody gave me permission that I could do this or that I should do it. I just decided, right? Another question that I get is like, well, how did you I don't have an answer, but people are like, well, how did you gain the confidence? Or like, why are you so comfortable with yourself that you can be authentically you? And I'm like, I don't know, but I just like don't care what other people say, or like, because no matter what, someone's going to trash talk you for some stupid reason, no matter what you do, you know. And those are the people that just are not your people. Like, you don't have to waste your time and energy with them. But it's not like I grew up in this like crazy household, like, right, I'm Asian, so my parents were immigrants, so like really in my culture, like I should be quiet and submissive and yes and blah blah blah, and that, and my parents did not fan my flame. Okay, so like that's not how it came here. I don't know if it just was like internal, or maybe it was like teachers that I had. Like, this sounds silly, but I had a teacher who was like the student council led, right? Like, she was my English teacher or anything, but I interacted with her from student council, and she really like poured into me and gave me lots of confidence. And I feel like taking dance when I was younger, like that's one of the things that I notably know like gave me confidence, right? So it's like so important, but it doesn't have to come from your parents or your friend. Like, there's different ways that you can learn and grow that confidence. And like now, like I love going to a restaurant by myself, and some people are like, how do you do that? I'm like, I don't know. I say, yeah, it's me, just one. And I love it because I can eat in peace, right? Like,
oh my God.
I don't want to sit at the bar because I don't want to talk to anybody. Like, I want to sit at my table by myself, like enjoy my own company.
Oh, that sounds so amazing. 3 kids later, I'm like, please just let me eat in peace.
Right. And I have no children. I'm still like, oh, this is lovely. This is just lovely, right?
Yes. Oh my gosh. I love it. Okay. So let's go back to dry eye a little bit. So what are some treatments that you love?
Intense pulse light is still my favorite treatment, but I will say, like I tell every patient, it's not magic, right? It's not going to cure you. It is not going to be like, it may not be life-changing for you, but most patients, majority of patients, most of the time will have improvement. And as far as anything else in terms of like prescription medication or other treatments, I don't think that that's the case, or not more often the case, right? So IPL does not work for everybody every time, for sure, okay? But I also think there's a difference in equipment, in technique, the buildup, and what's the aftercare, right? Like, there's so much that goes into it, because I have very, very few patients that have felt zero improvement with IPL. So I'm just like, when other people say it, it's not that I don't believe you, but maybe you have neurotrophic keratitis and your corneal nerves aren't sensing it, and that's why you're not having improvement, right? So you feel like IPL didn't work because your sensation is messed up, right? Or something like that. So when things are done correctly, like, I'm going to say I maybe have 3 patients that were like, nope, zero improvement out of, many. So I don't want to negate people's story, but it's also like, make sure that everything else is being done correctly to tee you up for the best success, right? But that is like still my favorite. That's like how I treat my dry eye, right? It's just doing IPL, plus my skin looks great because of it.
It does. It looks really good.
Thank you. So that's like my workhorse, and that's generally what I start with. But obviously, given their gland structure makes sense to do that, given there's rosacea, like, that it's the right treatment for patients, right?
And what is like the treatment plan for IPL? Is that something you do a couple times and then every so many months, or?
Good question. Depends on the patient, which is like not my cop-out answer. But FDA studies say at least 4. So even if you're mild, I always tell patients, I'm like, listen, you're doing 4. I don't care if you feel a difference after 1, you're doing 4, or else your results are not going to be longer lasting, right? Like, I hope that you feel a difference after 1, but 4 is really going to like put the nail in the coffin and get this under control. After that, there are going to be maintenance sessions, because dry eye is not curable, right? It is a chronic disease, so we have to keep doing work to keep it under control. Most patients can get by with 1 treatment every 6 months, and that's what I'd like try to aim to get patients to, right? But if they're really bad dry eye, if they're really young and it makes me nervous, right? Or they have like some kind of underlying autoimmune disease, or trying to get their hormones and stuff under control, that's when sometimes it'll be like, maybe I see you every 3 or 4 months, or I'll like wean you off. Like, we'll start at 3, then 4, then 5, and then we'll get to 6, right? But my goal is once every 6 months, which I think is maybe more lax actually than other practice. I know other people who are like every 3 months, and I don't know that I agree that that's necessary most of the time.
Yeah. Now, what do you say to the patients that say, I just keep putting drops in my eyes and it doesn't work?
So I say that, well, number one, we have to make sure that they're preservative free, because anything that comes in a bottle, most things that come in a bottle have preservative. Preservatives can dry your eye out. So like a lot of times people don't know that. So I'm like, if you're hitting that bottle more than 4 times a day, you're actually doing detriment versus helping. Second thing is that those things are like chapstick or lotion. There's no treatment. You can be on it forever and ever and ever, and your dry eye will not improve. Symptomatically, you will feel better for a couple minutes, but you will still be dry, right? It's just like, I think that patients think that that's a treatment because that's what their doctors told them to do, but it's not really fixing anything. It's just putting lotion on. Like, okay, you're not dry for a little bit, but it's going to come back, right?
Mm-hmm. Yeah. Now, what are some of like the internal whole body kind of things that you recommend? Are there anything in particular?
I'm really, because of this one lecture that I'm working on, I'm very like intrigued by how much hormone stuff goes on. So there are, I'm sure this is also becoming more prevalent like in women's health and hormone replacement therapy, which I'm glad for us, future us, that exists. But like, I've been making more referrals to people who deal with that kind of stuff, because if their hormones are imbalanced, no matter what I do from the outside, like it's not going to help, right? So it's like, number one, you have to make sure there's no systemic causes. So like referral to rheumatology to do blood work, or even I'll sometimes order blood work just to see like, is there an inflammatory factor, or like pull up your last blood work and let's see if there's a cause for that, right? Overall, obviously things that we eat are going to affect us. That's everybody, right? So it's like the things that are healthy for overall body is healthy for literally everything, like moderate amount of exercise every week, right? Like not being obese, eating food that's not processed. Like those are all things that every doctor's going to tell you because that helps everything, right?
Yeah.
But it's easier said than done.
Yeah. I remember Karen was a guest on my podcast, and she did hormone replacement therapy with like is it pellets or something? Uh-huh. And she was just like, it was like night and day difference. Like it totally made everything better. Like so many areas in her life. And so that is something I always just kind of keep in the back of my mind, that like, man, I didn't realize how much that could impact the eyes, especially,
Yes. Yeah. And that's like, let's say 10 years ago, like the poster child for a dry eye patient was a postmenopausal woman. Like that's really all that it affected, or that was the target. And that's still like, when I look at my patient population, like most of my patients are like 60-year-old women, like not all, but most.
Mm-hmm.
And that's my soul, like my soul creature is like, I'm an old lady at heart. So like it jives really well with me. Like I just feel like I'm seeing my friends all day.
I love it.
So this is probably also why I love what I do.
Yeah, for sure. I love that. Okay, so let's see. Where else do we want to go here? So let's talk about some like miracles that have happened along the way. Because you said your journey has not been a conventional one. But I wonder if there are like, and like you said, there was some luck that happened along the way. Can you pull a couple of these like stories that just like kind of stick out in your mind right now about bringing you to where you are now?
Yeah, I think there's like 2 things that are prominently for me. Like number one, the fact that my clinic is even open, that it exists and is still open, is a miracle. Like people are like, what? Like, especially in like the optometric space where we know, a little bit more about conventional practices, right? Like there's a lot of people who are doing dry eye, but most of the time they either have a feeder practice that's feeding them patients, and or they're literally servicing it from a bigger practice. I don't have either of those things. Like I don't have a feeder practice. I am fully referral and praying for referrals, right? And word of mouth. I also opened that after I moved from Philadelphia to Little Rock. So I literally had no patients. Like usually when people open up a cold start, like they've worked somewhere else close by, so they have some patients that are following them. I had 0. Nobody knew who I was. I didn't know any optometrist or ophthalmologist to even refer to me. I didn't have friends that were going to refer to me. I had 0 patients, 0 referral base, and it was a niche practice. Like I don't even have what's called a phoropter, where we say which one's better, 1 or 2. Like I don't even have that. I have no patient base. Like I'm going to open this niche practice halfway across the country with no friends.
Yeah.
Right? Like that's what it was. So it's crazy now that it's still open and growing, which is great, right? There's such a need for it. But that's, I think, the number one miracle, and I don't take that for granted. Like, I think that that's where I'm supposed to be, because there's no way that would have just worked out if it wasn't.
Correct.
Right? Yeah.
Yeah.
And then the second one was I had a really hard time, even though it was the right thing for my husband and I to do as a family, like moving to Dallas, I had a really hard time with it, because I was like, why did I work so hard to open this practice? And now when it's like starting to at least like be able to crawl, now I'm moving? Like, what was the point of me opening that practice? It would have been better for me to just open in Dallas, right? Like, why? And I had a hard time. But then like moving to Dallas now has opened up a lot of my consulting opportunities, because DFW is a huge airport, right? So I can get almost anywhere on a direct flight, and had those opportunities worked in Little Rock, like I wouldn't be able to do it as much, because everywhere's a layover. So it's just like these things that are like gifts and miracles that I'm like, I didn't put it together as that, but now I'm like, oh my gosh, yeah, I can leave after a half day of clinic if I want to, and come back on the first flight back and barely miss. Sometimes I can do it in a day. Like I fly out, do the program, come back the same night, right? Like, and that would never be an option in Little Rock.
No, definitely not.
So those are things that's like, sometimes miracles don't look like miracles, and maybe they are packaged in different ways, right? Exactly. Like to see the bright side of certain situations.
You're kicking and screaming the whole time until you get on the other side and you're like, oh, I get this now.
Yeah, because I had a really internal struggle about that, and now I can kind of see like, oh, this was all. And that's what I kind of say, like, everything works out in the end. If something didn't, then that wasn't what was supposed to be for you. There's something else. And it's not always magic and glittery.
No.
No, it's not. But you will always end up where you're supposed to be.
Yes, exactly. So your practice in, let's say, Little Rock, okay? Now, if people wanted to come see you from outside places and across the country, like how would they, what would they need to do?
Good question. Another silver lining back to that is like all of the patients that travel to see me, they're like, oh my gosh, if you open in Dallas, it will be so much easier for me, because direct flights.
Yes.
Everybody, right? So,
oh my gosh.
We'll see. That's not soon. Let's kick that down the road a little bit. Not right now. There's a lot of stuff going on, but I'm not ruling that out, right?
Yeah, that's amazing.
It's not.
Yes.
Mm-hmm. So it is a little bit difficult or tricky right now to get in to see me, because I'm really reducing the amount of new patients that I'm taking because of my availability, right? Like, I really love a lot of my patients, but the ones that are like my OG patients that have been there forever, like trusted me when nobody else even knew who I was, right? And like, that is my priority. That why do I go back and drive 4.5 hours is for those patients, right? So like, I want to make sure that when I'm there, I can service my patients, right? So I really am slowing down in terms of like how many new patients I'm taking. I am still taking new ones, but the wait list it's out, But Little Rock is nice because once you're there, like our office is like a less than 15-minute drive from the airport, and there's lots of hotels around. So we do have people that come to travel to see us. And obviously my office is happy to help figure out where to stay, all those kinds of accommodations if needed. And I'm always just so humbled, but also heartbroken when people have to choose to come to see me, because they shouldn't have to do that to get the help that they need. You know what I mean? I'm happy to help them, but I'm like, I wish it wasn't so hard for you, or that there must be somebody closer to you, right? Within driving distance. But when I talk to my colleagues that are kind of in the same space, we all have patients that just travel so far.
Yeah. And I guess the hope is that with the consults that you do and the education, that you're going to be teaching more people about this, and maybe about your services and how better to help these dry eye patients.
Yes, that's the goal. I think the hardest part about dry is actually the compassion, and like that you cannot teach. So like two people can do the exact same treatment, give you the same result, but the patient can feel totally differently about their experience, right?
Yes.
Yeah. So that's the part that's like, you either just kind of have it or you don't.
Yeah. No, I completely understand. When I was helping graduate students, or, mentoring graduate students, it was like, Yeah. The ones who like didn't get it. I'm like, I cannot teach you that. I cannot teach you how to be kind to someone. I cannot teach you how to give someone a hug if they're crying. Like, I'm sorry. I can tell you what to do, but if you are not feeling it, it's just not going to happen.
Yes.
Yeah. Well, Ada, I am so thankful that we were able to make this happen.
Yes.
And I wish you just so many more miracles in your life.
Thank you.
Again, love seeing you on Instagram. And
thank you.
I am so thankful that our paths crossed and so many these couple different times now.
Yeah.
And I hope to meet you in person sometime.
I hope so. Let me know when you come to Arkansas or
exactly.
Texas.
Yes. And then we'll have to go get dinner. You'll have to say 2 people, but it'll be okay. I won't talk too much.
We love to dine with you.
Yes. All right. Well, if anybody wants to get a hold of you, how can they do that?
On Instagram, it's Noh_eyes. That's my handle. Or you can call my office or look at my website.
That sounds perfect.
NohEyes.com.
Yes. And I'll put those in the show notes as well.
Thank you so much.
No, thank you. Thank you for listening to Miracle in Time. If you would like to explore a theme or know someone perfect for this podcast, please fill out a form on yourlightllc.com/podcast. If you would like to learn more about my services, you can visit the website at yourlightllc.com. I want you to remember that with all life's ups and downs, you are divinely held and guided throughout your journey. Don't miss out on this miracle in time.